Hello and welcome to Facebook Live with Avant Healthcare Professionals. My name is Shari Costantini and I'm CEO and founder of Avant. And I'm also the president of the American Association of International Healthcare Recruitment. And today we want to talk about the trade association that Avant is a founding member of. Because in the background of all we do, the trade association is working hard to advocate for international healthcare professionals, both here in the U.S. as well as abroad. So just a little bit of background about who the American Association of International Healthcare Recruitment is. It's the voice of international healthcare here in the U.S. We formed the trade association in 2007 as a result of the visa retrogression for nurses that lasted roughly 7 years. We all came together at that time, and today it represents 15 of the most tenured healthcare recruitment companies in the industry. And those range from staffing companies, like Avant Healthcare's model, to more of a direct placement model. We are the watchdog for the industry. So we represent the positive impact that international nurses are having on the healthcare workforce here in the U.S., especially during COVID-19. We highlight the positive stories, the American dream that so many international nurses realize once they arrive over here. And we do all of that in a very challenging regulatory environment. As we talk about this, there is a survey that's open online at www.AAIHR.org. And that survey is for international nurses working here in the U.S. to talk about the impact that COVID-19 has had on them in their facilities, as well as on them personally and for their families. So we'll take that data and compile it and use it in our advocacy efforts. And today, we're happy to say that we advocate for nurses from over 60 countries around the world that come into the U.S. The mission of Avant, or of the American Association of International Healthcare Recruitment, is to ensure that there's quality and compliance in the recruitment of international clinicians that supplement the U.S. workforce. We provide, or we advocate for providing educational programs that help that nurse transition to a safe and competent practice here in the U.S., really bridging the gap between practice overseas and here. We encourage ethical business practices, really the fair and consistent treatment, contracting from the employer as well as the healthcare professional. But we advocate for that fair and consistent regulation across agencies, whether it's state licensure boards or it's other regulatory bodies here in the U.S. that are part of that very lengthy and complex process that's required to become a clinician here in the U.S. We create and foster public awareness of the industry's positive impact on the healthcare environment. Again, referring back to that survey that I mentioned earlier, we will be publicizing those results both in our advocacy efforts in DC as well as other parts of the country where international healthcare professionals are making a significant impact. So just wanted to briefly talk about globalization of the U.S. nursing workforce. So since the 1960s, we've had an ongoing shortage here in the U.S. of clinicians. The peak of international recruitment was in 2004 to 2006, and there were roughly 20,000 international nurses coming in a year. And since that time, we've really seen an increasing in diversity of the international nurses coming in. So if I look back at some of those peak years, roughly 40% of the nurses taking the NCLEX, the National Licensure Exam here in the U.S., were Filipinos. And today that number is closer to 25%, which is just a reflection of nurses from other countries also interested in coming to the U.S. and taking the licensure exam here. It's estimated that around 14.2% of our 3.2 million nurse workforce in the U.S. are internationally educated nurses. And the diversity of our workforce is growing all of the time. We're roughly 10% or more of male nurses. We've got 21% minorities. And, you know, when I came into this profession many years ago, it was roughly 97% female. And so it's really nice to see that mix and that diversity, which is really a reflection of our patient population here in the U.S. So as I mentioned earlier, we do a lot of public advocacy efforts. Many of those are on the federal level. And, you know, this year, if you had tuned into an earlier webinar that I did on Facebook, it was about the Biden administration and what we can expect from immigration. But there is a push to do comprehensive immigration reform. The last time we had reform at this level was almost 40 years ago. I was around during our push in 2007, which is when we formed this trade association, as well as 2013, and now we're going to see that effort again. What we have been advocating for over the years is an elimination of the per country caps, but we want to do that in a way that doesn't backlog nurses from certain countries trying to come in or give preferential treatment to one country over another. So just trying to level the playing field. So what to look for in 2021 is if DACA passes, which is a very popular bill in Congress, which basically gives citizenship to minor children that were brought here and now have become adults. And so as a result of them being here and currently not being able to get citizenship, you'll see a big push for that this year. If that bill passes, we'll see other bills like the HWRA, which is the Healthcare Workforce Resilience Act. And again, if you watch that earlier webinar that I did on Facebook, you'll hear me talk a little bit about that bill and how that bill could give us several-year runway of no visa retrogression, which we historically deal with almost on an annual basis. Some of the other advocacy efforts that the Trade Association has in place is we work with foreign governments, we work with foreign international nurse organizations, really advocating for the right of individuals to migrate and to make that a fair and transparent process. We work with state licensure boards. Over the last several years, we've seen increasing requirements, whether it's for English scores that are different from those required on visa screen, or if it's specific educational requirements by state. So we're monitoring that, and that's been really important. And the Trade Association has made some really important inroads in several states that passed regulations that minimize the ability of international nurses to come in. We're also looking at co-employment. When you have a staffing model, which the vast majority of the staffing companies that are part of the Trade Association work under, there's co-employment concerns, which is where we place you at a hospital, and then that hospital also has some requirements during your employment tenure. But again, I think the overreaching thing we do in the industry is really to promote ethical standards for all recruitment companies. And that's transparency in contracting, in explaining to nurses what their commitment means, and then holding them to those commitments just like we hold ourselves to those commitments. Ethical recruitment, as I mentioned, is really an important cornerstone of the work the Trade Association does. We were the first organization to have a code of ethics for international recruitment in the U.S. And that code is really a living document. In 2010, it was updated to incorporate some of the verbiage and the aspects of the World Health Organization Code of Ethics for the migration of healthcare workers. In 2012, we developed a code for international healthcare professionals so that they really understood their ethical commitments when they signed up to come with a staffing company or a hospital directly. And in 2019, we introduced a new grievance process, which actually added an independent review board. So if a nurse goes to www.aaihr.org, one of the tabs on the website actually includes a grievance process. And that grievance process then will kick out to an independent review board, and those evaluators will review the grievance and compare it to the code to ensure that all parties are adhering to the code that they have committed to as part of working with a member of the trade association. So for more details on the code, the grievance process, the independent review board, please go to our website at www.aaihr.org. And so that's really the end of the highlights of the trade association. I think the biggest thing that I would share with you as a takeaway from this Facebook Live is to make sure that you are working with a staffing company that is committed to ethical practices, and also that's going to advocate for you at a very high level. If you are currently part of the Avant program, you know that we face challenges on an ongoing basis as the industry, whether it's increasing 221Gs or delays at the embassy or RFEs and denials at the Immigration Service. And you want to know that the company that you have trusted your journey to come to the U.S. to is actively advocating for you. And that's why we wanted to do this Facebook Live and really talk to you about this trade association that we are a part of here at Avant, and that's really advocating for this profession here in the U.S. and promoting all of the positive things that our internationally educated clinicians, nurses, therapists, med techs, and others are doing here in the U.S. So thank you for tuning in to Facebook Live today. And I look forward to seeing you here in the U.S. And you can always go to our website at AvantHealthcare.com and apply today if you're not already part of our process. So thanks for tuning in.